You know, it's kind of amazing how our pets, they're always getting into some kind of mischief.
Right. Always on the go.
And that's why, well, traumatic brain injuries or TBIs in pets, there's something we need to think about more.
They're a lot more common than many people might realize, especially with, like, car accidents.
Oh, yeah. Or for dogs, bite wounds, those are a big one.
Definitely. And today, we're diving deep into this topic, TBI in our companion animals.
We're going to try to take you through the whole thing.
We're using a recent review article to guide us.
So it's kind of like our roadmap for this deep dive.
We'll cover how vets figure out, how bad the TBI is and even what the newest treatments are out there.
The latest and greatest.
Exactly. So by the end of this, you'll have a much better grasp of TBI. And hopefully that means your furry friends will get the best possible care if something like this ever happens.
Because it's all about being prepared, right?
Absolutely. And this review article, it really makes it clear that a TBI isn't just like a one-time event.
It's not a simple thing.
No, it's a whole process, unfolds in stages.
So there's more to it than just, okay, there was an impact, and that's it.
Exactly. You've got the primary injury, which is that immediate damage from the actual force of the trauma.
Like bruises or bleeding, those sorts of things.
Exactly. Think contusions, hemorrhages, that direct injury to the brain tissue itself.
That makes sense.
But then there's this whole other wave that comes after, what we call secondary injury.
Okay, and that's where things get complicated.
And it gets pretty intricate, yeah. The article actually has this really helpful visual in Figure 1.
Oh, a diagram.
Yeah, a diagram that shows the whole cascade. Imagine, those delicate connections in the brain, the axons.
Right, the wiring of the brain.
Yeah, exactly. Well, they get disrupted by the impact.
Oh, so it's not just the cells themselves, but how they connect to each other.
Right. And that disruption, it sets off this wave of depolarization.
Depolarization?
Basically, think of it like an electrical storm in the brain.
Wow, so the brain's normal electrical activity gets thrown out of whack.
Yeah, completely thrown off. And this electrical chaos, it leads to an energy crisis.
Energy crisis meaning?
The brain cells aren't getting the energy they need to function properly. They're starved for energy.
That's got to be a serious problem.
Oh, it's a huge problem. This energy crisis throws off the balance of ions inside the brain cells, especially calcium.
Calcium, why is that important?
Well, you get this calcium overload, and that can trigger a chain reaction that eventually leads to those brain cells dying.
So it's like a domino effect.
Yeah, a really bad domino effect. And to make matters worse, the brain, it tries to compensate. It switches to this anaerobic metabolism.
Meaning it tries to make energy without using oxygen.
Exactly. And that produces lactic acid, like when your muscles get sore after a workout.
Oh, I felt that. So the brain is essentially getting sore.
Kind of, yeah. But in the brain, lactic acid buildup. It's really bad news. It can cause more damage.
So even after that initial injury, the brain is still fighting this uphill battle.
Absolutely. And on top of all that, there's the problem of intracranial hypertension, or ICH for short.
That's the, what was it? The pressure cooker effect.
Exactly. The skull, it's like a rigid box, right?
Yeah.
And there's this principle called the Monro-Kellie doctrine.
Okay, never heard of that.
Well, it basically says that any increase in volume inside that box, whether it's blood, brain tissue itself, or cerebrospinal fluid.
It all has to fit in there.
Right. And if one of those things increases, it's going to squeeze the others. And that means pressure.
So if the brain swells up from the injury or there's bleeding inside the skull, the pressure in that space just shoots up.
Exactly. And that's where something called cerebral perfusion pressure, or CPP, becomes really important.
CPP.
Okay, what's that?
Think of it like a garden hose.
Okay, I'm picturing it. The CPP is the difference between the pressure of the blood flowing to the brain and the pressure inside the skull.
So if the pressure inside the skull is too high, it's like squeezing the hose, right? Less blood gets through.
Perfect analogy. And even tiny changes in CTP, they can have huge impacts on how the brain functions.
That's scary to think about. So how do vets, how do they actually figure out how bad a TBI is? Like, are they pet detectives?
Well, they kind of are. The first clue is the neurological exam.
So they're looking at the pet, seeing how it's acting, moving around.
Right. The vet will check the pet's mental status. Is it alert? Are its reflexes normal? What's its posture like? How's it walking? All of that.
That makes sense. But I imagine it can't be easy to get a clear picture right away.
No, it's definitely tricky. Pain meds, the shock of the injury, those can mask the symptoms.
So the pet might not be showing all the signs, even if there's a problem.
Exactly. That's why vets often use a tool called the Modified Glasgow Coma Scale. We call it MGCS for short.
Modified Glasgow Coma Scale.
Yeah. It's actually adapted from human medicine. It's a scoring system that helps vets figure out how severe the TBI is.
Based on what?
It looks at things like the pet's motor activity, its brainstem reflexes, and its level of consciousness.
So the lower the score, the more serious the injury.
Exactly. And then there's imaging. CT scans are usually the first choice.
CT scans.
They're quick and good for spotting things that might need surgery, like fractures or bleeding.
And if they need a more detailed view,
Then an MRI might be recommended.
an MRI, that gives a really clear picture of the brain, right?
Yeah, it's much more detailed.
So let's say the vet has figured out how bad the TBI is. What's next? How do they decide what the best treatment is?
That's a great question. And honestly, there aren't any standardized guidelines yet in vet med for managing TBI. But this article, it proposes a new system called ABRIDGE.
ABRIDGE. What's that stand for?
It stands for Animal Brain Injury Groups. It's based on, get this, the brain injury guidelines that they use in human medicine.
So it's trying to bridge that gap between human and animal medicine.
Exactly. ABRIDGE, it looks at the MGCS score, whether there are any skull fractures, and if the animal is on blood thinners.
And based on that, they decide on the treatment.
Yeah, it helps them figure out how aggressively to treat the injury.
So it's like a triage system for TBI.
You got it. Mild cases might just need observation.
They keep an eye on the pet.
Right. Moderate cases, those probably need to be hospitalized. And then severe TBI cases, those need intensive care.
The ICU.
Exactly. And the article, it actually breaks down the specifics.
The statistics.
Yeah, for each ABRIDGE group, it recommends what diagnostics to run, blood tests, CT scans, that sort of thing, and what kind of treatments might be needed.
So it's kind of like a roadmap for vets, right, to help them navigate all this.
It's a great resource. Table 1 in the article lays it all out.
So we know how they figure out how bad it is. But what's the actual treatment like? What are the goals?
Well, the very first thing is always stabilization.
Making sure the pet is stable, their breathing and heart rate are okay.
Exactly. The ABCs, airway, breathing, circulation.
And once the pet's stable, then what?
Then one of the most crucial things is managing that intracranial hypertension, that pressure cooker we talked about.
Because that pressure, it can really restrict blood flow to the brain, right? Right. And cause even more damage.
You got it. So vets often use these special fluids called hyperosmolar fluids.
Hyperosmolar fluids, what do they do?
They basically pull water out of the brain tissue. It creates more space inside the skull.
So it's like giving the brain a little bit of breathing room.
Exactly. Hypertonic saline and mannitol. Those are the two most common ones.
And are they both equally effective?
There's some debate about that. Which one is better? It often depends on the individual patient.
And what about oxygen? That's important for the brain too, right?
Oh, absolutely. Getting the right amount of oxygen to the brain is crucial.
Not too much, not too little, just right.
Yeah, the Goldilocks zone.
Makes sense. And what about pain relief? Poor things, they must be in a lot of pain.
Pain management is huge, yeah. Not only for the pet's comfort, but agitation can actually make that intracranial pressure worse.
So keeping them calm is part of the treatment too.
It's all connected. Opioids like fentanyl or methadone, those are usually the go-to for pain relief.
Strong stuff.
Yeah, but they're effective. There's also ketamine, which is gaining some traction.
Ketamine? I thought that was like an anesthetic.
It is, but it also seems to help with pain relief and, get this, might actually protect the brain too.
So it's like a multitasker drug.
Exactly. And along with pain relief, often sedation is necessary too.
To keep them calm and from hurting themselves.
Exactly. There are a couple of options that look really promising, propofol and dexmedetomidine. They seem to calm the brain down without messing with blood pressure too much.
So they're good options to keep the pet comfortable and stable.
Right. And then we've got temperature control. Fever after a TBI is a big no-no. It needs to be treated right away.
Why is fever so dangerous in this case?
It basically ramps up the inflammation in the brain and makes the damage worse. So yeah, we want to keep things cool.
Literally and figuratively.
Exactly. And then there's the challenge of preventing complications that can pop up. Things like hyponatremia.
Hyponatremia.
It means low sodium in the blood. It can really mess with the brain's chemistry.
So it's all about maintaining that balance inside the brain.
Absolutely. The goal of all this treatment is to stop any further damage and give the brain the best chance to heal. It's really amazing when you think about it, how much we're learning about TBI and pets all the time.
Yeah, veterinary medicine is really pushing the boundaries.
It is. And with TBI, one thing that always strikes me is just how resilient animals are.
Right. I mean, it's incredible how they can bounce back from these really serious injuries.
It really shows you the power of the brain, its plasticity, that ability to adapt and rewire
It's
itself.
like a secret superpower they have.
Exactly. And with more research, better treatments in veterinary neurology, things are looking even better for recovery.
That's really encouraging to hear.
Definitely. And it underscores how important early intervention is. Specialized care. I mean, if your pet ever hits their head, has some kind of trauma, getting them to a veterinary neurologist is just so important.
Yeah, they're the brain experts, right?
Exactly. They know how to assess the injury, manage any complications, and guide the rehab process.
And speaking of rehab, that's another area where we're seeing some incredible progress.
Absolutely. Just like with people, physical therapy can make a huge difference for pets recovering from TBI.
It helps them get back on their feet, literally, right?
Yeah.
Regain that function, improve their mobility, and just have a better quality of life.
Precisely. And the research shows the earlier and more intensive the rehab, the better the outcome in the long run.
So it's not just about getting them through the initial injury, but making sure they can thrive afterwards.
That's the goal. And there are so many options now. Underwater treadmills, balance exercises, laser therapy, even acupuncture.
Wow, that's quite a range.
It is. And the best part is it's always tailored to the individual pet, what they need, what they're capable of.
So it's a really personalized approach to healing.
Exactly. And rehab isn't just physical, It's about addressing any cognitive or behavioral changes that might come up after a TBI.
That's a good point. A TBI can really affect their personality, how they interact with the world.
Absolutely. And that's where things like environmental enrichment, behavior modification, even medication can be helpful.
So it's really a holistic approach, looking at their physical, cognitive, and emotional well-being.
Exactly. We want to treat the whole patient, not just the injury itself.
And I imagine that takes a lot of teamwork, right? Between the vet neurologist, the rehab team, and, of course, the pet owner.
Absolutely. The owner plays a huge role. They provide that constant support, encouragement, and the loving environment the pet needs to recover.
It's a true team effort with the pet at the center.
That's the beauty of veterinary medicine, that bond between humans and animals.
Well said. So we've learned a lot about TBI. It's complex, but there's so much innovation and hope in this field.
And that hope translates into real improvements for these pets.
It's really inspiring.
For me, the most exciting part is just how much we're learning about the brain's ability to heal and adapt.
It's like we're just scratching the surface of what's possible.
Exactly. And with the right interventions, we can help those possibilities become reality.
So TBI, it's serious, but it doesn't have to be a hopeless situation.
Not at all. With better diagnostics, treatments, and rehab, we're giving pets a fighting chance to not just survive, but thrive after TBI.
And that's what it's all about, right? Giving them back their quality of life.
Absolutely.
So for everyone listening, if your pet ever has head trauma, please seek expert care.
That early intervention can make all the difference. And with those amazing vet neurologists out there, plus the incredible resilience of animals, there's always reason to be hopeful.
This has been a really eye-opening deep dive into TBI. We've gone through the science, the tough parts, and the progress being made.
We hope you've learned something new and that you feel better equipped to handle this complex topic if you ever need to.
Knowledge is power, especially when it comes to our furry family members.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging. One of the things that's really fascinating to me is how much human and veterinary medicine, when it comes to TBI, how much they actually have in common.
It's amazing, right, how much we can learn from each other.
Yeah, a lot of the tools they use to diagnose TBI in people, the treatments, even the rehab techniques, they're being used in vet med now, or at least being researched.
It's like this constant exchange of information. Both fields are pushing each other forward.
Exactly. And that sharing of ideas, it's leading to some pretty incredible advancements.
It's like those 3D printed collagen scaffolds we were talking about earlier. I mean, the idea that you could implant something that helps brain tissue regenerate, it's mind-blowing.
It really is, and it could be a game changer, not just for pets, but maybe for people too, down the road.
So VetMed is actually contributing to human health research too.
Absolutely. By studying TBI in animals, we can figure out how the injury happens, test out new therapies, and maybe even pave the way for clinical trials in humans.
So everyone benefits.
Exactly. It shows you how connected we all are,
Yeah, we can learn so much from each other no matter what species we're talking about.
This deep dive has been a good reminder of that. the search for knowledge, it goes beyond those boundaries.
We're all in this together, figuring the brain, how it heals, how it works.
And that search, it comes from compassion, from curiosity, and just a real respect for how resilient life is.
This whole journey into TBI and companion animals, it's been really eye-opening, inspiring too. The science, the challenges, and all those glimmers of hope coming from the research and those dedicated vet specialists.
We hope you've gotten a better understanding of this complex topic and that you feel empowered to be an advocate for your pet if they ever face this challenge.
Because knowledge is power, right?
It is.
Let's use what we've learned to make sure that all pets, no matter what they go through, get the best care possible and have the chance to live happy, full lives.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.